We're live.
Oh, thank you. Good afternoon, everybody, and welcome to Live with Noelle. And today's show, I'm really excited to introduce you to a wonderful and awesome guest of mine. And I hope everyone that is logged in, please let us know where you are coming in from. And if you have any questions throughout the show, let us know. But without further ado, I'd like to introduce Dr. Steve Ambrose to you. I had met Steve actually through LinkedIn, through similar synergies. We connected several months back. And we are going to be talking today about how to reduce toxic incivility in healthcare. And before we get started to talk about this really important subject that impacts everybody, throughout the nation, I want to have Steve introduce himself, his background, and how he got started in the work that he's in now. So Steve, welcome to the show. I'm looking forward to having you on.
Yeah, Noelle, thanks for having me. Hopefully you can hear me. I think we got the mics all set up here. And I just want to let the audience know that I've gotten ready for this for quite a while, and I've even got my hair looking just right. So any compliments appreciated. Thanks for having me on. I really, really appreciate the time dedicated to this particular challenge and topic. My history in healthcare is about a quarter century. And for a good part of that, I was a clinic-owning physician in Richmond, Virginia. And so actually I was a chiropractor. And a lot of people look at chiropractic and they may be thinking, oh, chiropractic, well, that's not medicine. Well, actually, a lot of the soft skills and the interpersonal skills that I learned, I picked up through serving up to 50 patients a day for about 20 years. I had a very busy practice. And so in many ways, what we're seeing today in patient engagement, patient journey, patient communication, this was the norm in my practice because basically, you ate what you hunted and killed in a sense that if you did really well with engagement and education, you kept and retained patients. Medicine understands that more than ever, but that was something that was my bread and butter. Outside of practice, Noelle, I also went ahead and I had a career with software. While I was in practice, I raised money and developed a very unique platform for combining insurance data with health payer claims data. And then outside of that, I've also held roles as vice president of strategy and communication for a consumer financial organization. And then I've run a podcast myself. Coming into what I do now, Walk the Ridge, this started about 2 years ago. I've always had a mindset where I'm looking to fill gaps. And essentially, one of the things that I get tired of hearing over and over was how civil we needed to be as a country. You'd hear it on the news, you'd hear it from business leaders, you'd hear it from people in Hollywood. You hear it everywhere. We need to just be more civil. We need to listen to each other more. All of that is wonderful to espouse, and all that's wonderful to put into policy. But there's a real gap between telling somebody to be civil or calling on civility, as it were, versus giving people a real meat on the bone practice that they can put into use for themselves. And I realized there was a gap there. My wife and I both did, actually. We started this organization, Walk the Ridge, together, and we recognized that people need to not only be taught skills and techniques, but they need to embrace it, practice it, and really be accountable for it. So combining those three things was a big part of the solution that I've developed with Walk the Ridge, and also where I'm putting a good part of my life and dedication, around a real walk rather than just talk, which we unfortunately just hear too much of.
And you bring up such a good point in that there is so much conversation, but you don't see a lot of action and throughput to the conversations that we have within healthcare about incivility and the impact that actually has not only on an organization, but the people themselves. And depending on the type of organization, how is that impacting the outcomes of what you're trying to achieve. And I want to talk a little bit about your welcoming Walk the Ridge into the world, because that title in itself engaged me in our conversation. I'm like, Walk the Ridge. And I was, that intrigued me to want to know and understand more about you and what you're doing right now. So if we could talk a little bit about Walk the Ridge and where you came up with the concept of calling it Walk the Ridge.
Well, certainly. Thank you so much. And I just want to let the audience know too, I'm going to jump right into this, but two very quick things.
Yeah.
If anybody needs to reach out to me, you can just reach me, steve@walktheridge.com. And another thing is, throughout the show here, I didn't mention it before, but I'm probably going to be dripping in some links. A lot of them are really helpful links, and I'll put them in the chat. So if I go to typing a little bit, just know that the links are very useful, very helpful, and I promise you'll do better off storing them and clicking on them later. So that being said, the idea for Walk the Ridge originally came from my wife, Nellie, who she's wonderful. And the idea being is that we certainly have differences today in a whole host of different subject matter. It could be, what do you think about Black Lives Matter? What do you want to watch for a Netflix movie tonight, or where do you want to go to dinner, or who should we hire to run the marketing activities for our healthcare organization? Any sort of subject matter where there's going to be some real differences of opinion or differences of view, we look at it pretty much as a mountain. And on either side of that mountain, you have what's called valleys of opinion. And, years ago, we've always had incivility. We've always had differences of views. The problem is that today, one difference of opinion or view is taught to almost hate or vehemently despise another side.
Yes.
And so when Walk the Ridge, what we're doing is we're teaching people as individuals to come up from those valleys and basically meet at the top of the mountain, not to compromise, not to give up your views or your beliefs or your opinions, but to basically find that little ridge on the top of the mountain where there's shared respect, shared listening, and shared understanding. And that's a big part of what we do with our bands. Like you see, I've got what's on this side? I've got a pin here, and I don't know if you can get a close up, but there's a lapel pin we have. But this is what we originally started out with, which is our band. And you'll see if you go to Walk the Ridge, there's a logo here. That logo actually carries a motto that says on the band, "I see you, I hear you, I respect you." It doesn't say I agree with you, and that's really important. But those are the three core values that we drill and teach on when you're walking the ridge, as it were, or you're practicing healthier engagement with people during stress or disagreement. And the nice part about this, Noelle, is anybody can do it. It's meant for any level of employee. It is not executive learning. That's not what we're going after here. And you can take it with you when you learn the tools and the techniques of walking the ridge. You can use it at home. You can use it online. You can use it at work. And it's a lifesaver. In many ways, it's a relationship saver too. So that's how Walk the Ridge came about. And if you go to Walk the Ridge and click on the About button, you'll see our logo. It's got a lot of different symbolism to it, but we carry that through our training. So I definitely appreciate you asking.
And so I want to go back to something you said that really sticks to me. And that's the part of, I see you, I hear you, I respect you, but it doesn't necessarily mean I agree with you. That is very crucial when you talk about change. When you talk about systems and processes and where that goes. And I want to ask you, in your experience, have you had, I guess what I'm trying to say is, not only in your experience, but if you look at your program too, people that have had that sort of stumbling of thinking or perceiving that you understand everything, and wait, what do you mean you don't agree with me? Because it's all in how you say what you say, right? And I have found that if done correctly, and I look at all of the work that you've done, it's very easy to accept the fact that you may not agree with me if you have all of those other concepts put into place.
Yeah, like mindfulness, like
Yeah.
confidence in your own views, where you don't have to control other people or control a conversation. You don't have to win where somebody else has to lose in order for your view to be valid, right? Your view is your view because you have mindfulness, you have confidence in your view, you have confidence in yourself, and you're not looking and forcing people to validate and agree, which quite frankly, even if people do,
Mm-hmm.
most of the time what winds up happening is they really don't. They're really just trying to please you to move forward in the conversation. And then, like, one of the things I think we talked about before the show is this idea of um, what I like to call battle tested inclusion.
Mm-hmm.
And today it seems very popular to feel like that if we're all on the same side of a particular social issue or a same side of where we should take our company or how we should do things, well, that's inclusion. And trying to get everybody to agree on one thing is hard enough. And then masquerading it as real inclusion
Mm-hmm.
is not genuine. It's not genuinely felt. And frankly, a lot of the underpinnings of that, a lot of the foundation of that kind of thinking about inclusion is just going to cause people and teams to sort of erode in the long run.
Mm-hmm.
Um, I think people are always going to be different, Noelle. And I think that if you teach people how to use the art of communication in a way where they feel genuinely more confident, they feel like they have greater control in a conversation, even through disagreement. Um, and you really have the mindfulness not to use more emotions, but more logic in your thinking and your actions. That's the key.
Yes.
And then to spread it, not just for individuals, but then to spread it in a whole organization, to drip it in.
Mm-hmm.
That's really what Walk the Ridge is about. And that's where I think that's what I think the right direction is on where we need to be going with, let's say, inclusion, just as one area.
Right. And I love that you said that, taking the emotion out of it, because when you look at how this program really is for everybody, you're talking to most of individuals within your organization that you want to tap into that are actually the key stakeholders to creating the outcomes you're looking for. They're on the front lines, whatever that front line looks like and
Yes.
whatever it may be. And these people act with passion. And a lot of passion comes from feelings, which comes from emotion. So to understand the difference
Yes.
in how to process things in a different manner that doesn't come from an emotional standpoint really needs to get down from, you almost need to work bottom up and not top down.
Yes.
And,
Yes.
and that's where it comes
Yes,
from.
exactly.
And you
Yeah.
know, and it's
No, I
interesting because I take your concepts and I think about our conversations that we've had, and I look at the work, even what I'm doing here where I am, and I love it because it's all the people on the front lines, but they want it. They want to understand, they want to learn, and they're trying to process, how do you take out the toxic negativity piece and learn from that and sort of pivot it into a new
yeah,
direction. And that
I
really
love
ties
it.
into my next question that I want to ask you. And you know, when we talk about incivility and then you have toxic incivility, and I really look at healthcare, where we're at today in very different times, there's a
Mhm.
lot of burnout happening right now. There's a lot of turnover.
Yeah.
And I'd like to talk to you a little bit about your experience and how toxic incivility relates to burnout, retention, and all of those other aspects when we look at key measures that healthcare organizations are trying to work on.
Yeah, the first thing is, I really love the point, to go back to the prior question, just your ending point. I love your point about just bottom up. That is the whole crux of what we're doing here in the way we distribute it. This is not a $10,000 executive weekend course or whatever. This is, 10, $12 a person, and 40,000 people get it, because 40,000 people can be beacons of light for
Right.
improvement all throughout the year, right? everywhere. I don't know if you're a movie buff, but I'm a movie buff. And one of the movies that I've loved in the 80s was a movie called The Color of Money with
Yep.
Paul Newman and Tom Cruise. And
Yes.
Paul Newman has a great line in there that says, one of the things I realized is money won is twice as sweet as money earned. And I think that's the way it is with skills.
Mm-hmm.
And that is that you can have people espousing and placating and putting policies in and giving fancy talks about we need to be more empathetic, we need to be better listeners. But when people actually put that into their own life and they get empowered by that, and they can genuinely feel the results and see the results happening. And we talk about this in the program, and in the program we have, it is twice as sweet as just having somebody tell it to you, and that's what we don't have enough of. So that point, I really appreciate that flattening concept, Noelle, that you brought out. As far as burnout and incivility, just a few things I want to say. I shared a link in the chat, which I would love everybody to go to now, and it's a link on statistics. This is it's ever growing. We're adding this in on our site. There are so many statistics around incivility in healthcare, and the data is just coming to the surface now. I think the newest data shows, we talk about like physician burnout, but really, let's be candid, right? Burnout happens to everybody. And I don't think that's talked enough about. Like for me, I think nurses outnumber doctors something like 4-1. I could be wrong on those stats.
You're pretty close.
The
Yeah.
latest studies that have just come out in January of this year show that 54% of nurses experience some form of burnout. And I think you've already got 46% of physicians, not to mention the rest of the staff, right? And it's and what is burnout? So burnout's made up of three things. It's made up out of exhaustion, depersonalization, and then feeling a lack of value in oneself. And those three things are a nasty little toxic mix. And incivility on the depersonalization side is a monster of a contributor, Noelle. And just to the audience here, you'll see it in the stats link when you go to it. But Medscape just came out with an amazing study on, they did physician burnout. I imagine it's equally applicable to nurses and other staff. But number two, out of all the reasons that physicians cited as a causal reason for burnout, incivility, lack of respect from peers, from administrators, from even people reporting up through physicians, was number two of all the reasons. There are like 12 of them. 5 years ago, Noelle, the same study by Medscape, same exact study on burnout, put incivility down at number 12. So we're talking about literally a huge move up in causality. And frankly, I think that's something we need to note. It's happening everywhere. And mostly, I think, because incivility, Noelle, just candidly, I think that it's not imparted on people because they're educated.
Right.
These are learned skills. These are learned mindsets. These are emotional triggers, and controlling them that takes practice like anything else. And I think that, and also to your point before, which I really agree with, on what I call the behavioral front, we're not flattening expectations.
Right.
Oh, the doctor gets a pass because he or she is a really important doctor, and they generate a lot of business for us at the hospital here. Or the nurse has had 25 years, give her a break. When you lose accountability, especially that's flattened out, then people see that.
Yes.
People get uninspired. And that's part of the thing I think we have to fix, that we do with Walk the Ridge, is we set that in as part of the program.
Yes.
So it's learning, development, and then accountability. So very, very important that we address that. But yeah, incivility is a huge contributor to a lot of areas in healthcare, including staffing, retention, burnout, even Here's one: 71% of physicians and nurses actually cite incivility as a causal reason for medical errors. And
Yes.
27%
Wow.
cite it as a causal reason for, wait for it, patient death. So,
Wow. And I believe that.
I'm telling you, these are toxic gaps that exist, and they're not being addressed, and they're
Right.
eroding the culture and the foundation of the culture. And it's just everybody's flying past it because it's almost considered a common norm.
Mm-hmm.
But it is like death by 1,000 paper
Mm-hmm.
cuts. That's the way it works.
I mean, and to that point, you're looking at it, your environment will precede you, right? If your environment isn't a healthy working environment, it will be to the demise of the success. And unfortunately, if it's healthcare, it could be the demise of a patient or an error that is made on behalf of the staff. And you brought up a great point when you look at your program, because before you can be held accountable for anything, you need to understand what it is you're being accountable for.
Yeah.
And I think we throw these words around overall in the world of you're incivility, and without actually what does that mean to you? Or you're not being accountable. Okay, to what? It's so broad that we don't break it down to bringing it back to the basics. What are you accountable for? What does this look like to you? How can you fix this? You get to each layer of profession, starting from the bottom up. It's going to have a different impact in a different meeting. And it's going to be the leader's responsibility to get to each one of those layers and impact them that way. And I think this is where I love Walking the Ridge, because the program in itself addresses each individual in each layer that they work in. And these are basic human concepts, right?
Yeah, they are. It's
it's the hardest and most complex, but basic human concepts.
Yes. And I'm going to pull this just a hair closer, but just to go back to movies again, because I just love movies, but there's a movie called Margin Call in 2011. Jeremy Irons was in it, Kevin Spacey, the late Kevin Spacey.
Okay.
But, one of the lines in the movie, he says, there's a big blow up in the company, and he's the chairman of the board, and he steps in, and it's going to cost hundreds of billions of dollars. And he has to find out what's wrong. And he says to the young guy who's found this major error in the company, he says, just tell me the nature of the problem and speak to me like you would a young child or perhaps a golden retriever. And that's the way that I've designed Walking the Ridge. The whole basis is I'm not going to sit down and talk about the 42 points of emotional intelligence or whatever. That's going to fly over everybody's head. Yep. And who are we kidding, right? That's what happens. And the only person it impresses is the presenter. So I'm not looking to be impressive. What I'm looking to do is get out lunchbox learning that everybody can understand, take people through a 3-hour online journey that has 5 different modules. Everybody's going to get something different out of it. You can come back to it over the course of a year. You can come back as many times as you want to the program. And you're not going to come out of it like Mr. Rogers or Mother Teresa, right? You may get better at empathy. You may get better at the principle of charity, or asking open-ended questions, or the ABC technique, or all the different things we teach in there in bite-sized modules. But the point is that everybody's on a different journey with this, but everybody can be empowered. And then the nice thing is, go ahead and turn, 100, 1,000, or 50,000 people loose that are empowered for the good with some accountability on they do. Like that, when you're wearing this or you're wearing a band, one of the things we teach is you can be called out. Like, we have people that buy our bands that literally in a meeting, Noelle, it'll get kind of nasty and testy, and people will literally put up their wristband and say, hey guys, like, we're walking the ridge here. Let's keep the conversation civil. instant check.
Yes.
Those peer-to-peer instant checks don't largely exist today. It's hold it in,
Yeah.
take the incivility,
Yep.
bury it, or report it to HR. And God knows HR is deluged with this.
Right.
So, what about actually going ahead and empowering peers to manage themselves? So, look, triggering happens, microaggressions happen. I'm not saying they don't. But boy, if we could take those and let's say, for example, make those an empowering experience
Yes.
for a person instead of a victimizing experience, what a difference it would mean to relationships, and then just
Mm-hmm.
start piling those incidents one on top of the other. And
Mm-hmm.
now you're laying a nice little foundation that fills in the cracks on D&I, employee
Yes.
engagement, employee relations, what
Mhm.
have you. It fills cracks, right? That's what we're going after here.
And what a difference it makes in the value you feel for yourself, right? There's so
Yeah.
much self-confidence that goes into having the ability to respond in that way, knowing that there's this mutual understanding of the group that we are in this together. And
Yes.
this is almost like the all teach, all learn type of environment, but it's like I love the bracelet concept. I love that.
Or the
And
pin. Some people like the pin because they don't want to wear a bracelet. So
yeah,
they put it on their thing. It's a visual anchor, right? It's meant
and
to catch the eye. So
yes.
you're reminded,
And
right?
people ask, right? And if they're going to ask, you have to be able to talk about it and
Right.
learn about it. And the more you talk about what you're doing, the more confident you feel and the more you're actually living by that vision, right? You're living by that mission. If I had that badge on and the more people ask me about it, you almost become hardwired in that state of mind of what you're doing. And, that too shall follow.
Yes.
I would
That's why do you wear the bracelet? Well, it just helps me be more civil. Now you put yourself out there, right? It's like Weight Watchers, or
yes.
I can't say that word anymore. WW. Um, but the point is, you step on the scale, you become accountable to people, and when you make yourself accountable, like to your point, you're accountable. Like you're going to make mistakes, but you've got to be willing to get better. And that's not going to happen because some company CEO placates it and says, "Yeah, we're all about inclusion here. We're one family." Well, that's great. Like, but is it really lived? Are you just espousing it in your PR statements, or we don't like hate. We're against hate. Okay, well, like I think everybody is. Like,
Yeah, yeah.
but let's get into right. I mean, let's get into the cracks here,
Yeah.
like you said, Noelle, on the front lines, so that you could put real purpose and action into more than just words. Right? That's what people want, I think.
I agree. You had mentioned something earlier on about battle testing. What is that? Talk to me a little bit more about the key to battle testing.
Oh yeah.
Oh yeah, he says.
Let me start off by saying first that let me start off first by saying that I had a discussion with Eric Mitchell, who's the DEI officer at Livongo, and you can access that if you go to Walk the Ridge. I'll just I mean, everybody pretty much knows it, but I'll just put in Walk the Ridge right here. And if you go to there and you go, I think, on media, you can listen to the conversation we had on battle testing inclusion. And I think one of the things that is happening today, in my opinion, with DEI, and I'm very outspoken about this, by the way, which some people don't like. Most people actually agree with it, but it's okay if they don't. Um, I think DE and I needs to be separated, frankly. I really think
Tell me why.
diversity and equity should be one function, and inclusion, trust, and belonging should be another. I think there should be two separate leaders running it, and you can pull it together. I'm all for that, of course. But you've got people out there leading DE&I that are not really about inclusion, trust, and belonging. They're about, you know what, we're going to go ahead and stand behind this particular cause, this particular statement, and you're with us or you might be against us. And
Mhm.
there's really no wiggle room there, right? And I think what that does is it shuts down a lot of belonging and contribution and trust. And we had this conversation, and I said as a good example, I said, Eric, this was during the whole George Floyd thing.
Mhm.
I said, I don't think that, and again, I don't want to make this political because it's not meant to be. This is just use an example.
Mhm.
But candidly, I mean, let's be real. There's a lot of people who are Caucasian, who are white, who may not necessarily fall into the same views as people who may be, let's say, certain supporters of, let's say, the organization Black Lives Matter. Maybe
Right.
they do. Maybe they're not. Can they speak up and say anything, or can they not? Can people of color speak up and say anything when they feel they want to? It's that ability to sort of say again, and it gets to sort of not necessarily harsh disagreement, but if you feel a little different about something, do you feel safe?
Right.
Are you psychologically safe to give your views or to
Right.
give your differences? And is it equally applied to everybody?
Mhm.
And see, that's the sort of thing I think that not all, but I'm seeing a lot of DE and I leaders taking some very rigid positions. And if you don't agree, then you're this sort of like you're framed into, you're either with us or you're against us. And I don't think most people gel with that. I think people tend to be, I don't know who said this years ago, maybe Zig Ziglar, but most people tend to be like wet cooked spaghetti. You
Mhm.
know, they can be pulled, but they don't do very well when you try to push it.
Right.
And people are like that. And I think we need to recognize that. And battle testing inclusion to me
Mhm.
means a lot of the principles that say, how do you work with people when they don't necessarily agree with you? Or if you're under a lot of stress and you tend to be controlling, or you tend to be somebody that doesn't speak up because you're fearful of speaking up. I think battle tested inclusion means just that. You have foundations underneath that really not only empower those things to happen
Mhm.
in all settings and in all subject matter, but also when it doesn't work out, everybody is freely willing to learn and grow from it, as opposed to polarization, or
Mhm.
we're going to form cliques here and cliques here. And
Mhm. Great point.
that happens, of course, all the time. And it's just unhealthy to have an issue with. And so I do think that a lot of times, if you separate the two out, you're going to get more growth, which is obviously diversity and equity. We need much more growth than that anyway. But both sides really need to grow. And I think decoupled, as I told Eric this on our interview, I think decoupling would be a huge positive in this area. And I think it's just too much necessarily to ask of one leader to do it all or to lead it all. Just my
Absolutely.
opinion on it. But that's battle tested inclusion to me is a lot more than just saying we're
Right.
inclusive and then putting out nice PR statements that aren't really felt, as you would say and I would say, on the front lines.
Right. It's not a
People.
good reflection. It actually
No.
wouldn't reflect the team. And and it's interesting too, because when you look at, again, you look at these words, right? And I just had this conversation shortly a short time ago. Um and diversity isn't just you being black, white, brown.
No.
There's so much that goes into what diversity looks like, and there's so much that goes into inclusion. I couldn't even list the number of things that we look at when we focus on diversity, and it's almost a knowledge deficit that as a leader, if you don't fully understand the concept of what that is and what that looks like, you're not going to be able to teach your employees how to live by these type of standards. And it's going to
Yes.
be very hard that if you don't yourself have that buy-in or that understanding, you know, you're
So you're right.
what are you going to do right there, right? I mean,
Yeah.
you lead, and the way that you lead is giving those around you permission to behave the way that they are. So you leaders have to take a really big step back and reflect that if your team is not behaving how you want them to be, you need to figure out how to lead them differently.
I see you. I hear you. I respect you.
Exactly.
Again, like that Jeremy Irons, like in the movie, like you're talking to a young child. Simple concepts,
Exactly.
simple concepts that help to form great foundations, not complicated 20-page,
Nope.
mega step things where you get so many levels of earning, that's all fine. But I'm talking about wide empowerment here, right? We're talking about making, instead of taking a few executives in a 50,000 person health system and
Right.
making them better and expecting them to trickle down their knowledge and their teaching to everybody else and their managers and whatnot. How about getting everybody 5% better and then letting them start dripping in,
Yeah.
right? In phone calls, in office meetings, in cubicle conversations, in texts, start dripping in betterment by sheer numbers.
Right.
That's what I'm talking about, and I know you're on board with.
And so I want to ask you too, when you look at the program, what does that look like for those that are watching? Is it a constant? Is there does it go to a certain length? Do they graduate and move on? I want to talk a little bit more about the program. And
Okay. So, and I'm kind of, pardon me, I'm just looking at it on here so I can look at every little thing. The way that this, first of all, what I'm going to do, and I'm going to lay out a link here for everybody who's on, please just note the link here. I'm just going to put it in, and it is, okay.
And actually, before we get into that, Ralph asked a great question. And that was that he noticed earlier we were talking about triggers. And what are some trigger words that we can use to diffuse a potential conflict?
Well, I don't think there's any magical words. And we talk about triggering and microaggressions in Walk the Ridge. One of the lessons we talk about is what we call the principle of charity. And as a matter of fact, I'm kind of getting ahead of myself, but one of the gifts that I'm going to give listeners today is I'm going to give them the ability to download that entire lesson for free and to use it. And so I'm going to go ahead and give a link for that shortly. But as far as specific trigger words, I think the most important thing is rather than particular words, it's the actions. So I'll give you a great example. Let's say that you have a disagreement with somebody, and instead of name calling or shaming or blaming, which would be a triggering action, why not ask open-ended questions? Whether you agree with somebody or not, that's not the point. The point is to respect somebody, right? You don't necessarily have to agree with somebody to respect them. And that's a big separating point that we teach here. So ask some open-ended questions. And Noelle, I know you feel a little bit differently than I do about who we're going to hire for our marketing team. Take me through maybe why you're thinking that she may be the best hire for this particular time. I'd love to know. Even if I don't agree, I'm having you feel respected. I'm opening up the floor to let you speak the way you feel. And that's a great bonding tool. And it's not done enough. So, and we go over that in a lot of different ways in the solution. But the other thing is to look at what happens when there's a triggering event. Are you going to look at that as a victim or a victor? And I'm not just playing on words here. I go through on this principle of charity lesson. I really go through some of the steps that people can take. A lot of it has to do with mindfulness. Remember, we talked about being, controlling your emotions. It's not that you don't necessarily have a right to be angry with what somebody said. Or if somebody said something really angered you or upset you, that, you don't have a right to say something. But you have to think a couple steps ahead. What's the intent? If your intent is to shame and blame and humiliate right back over the top, what have you done to make the situation better? How are you better than the other person?
Right.
Or if you shun the other person after triggering, don't talk to them anymore. or rarely talk to them. Now that starts to impact the team, right? The clinical team or the administrative team. So that doesn't work. So how do you work in mindfulness so when you're triggered right in the moment, you've got an immediate plan that you can put right into play, and your intent is to help the other person, to take them across the bridge and say, listen, you said something to me that really offended me, and I have to let you know that. But I'm telling you because I don't want you to say it to somebody else who's going to make a bigger deal out of it. I want to help you through this. And 9 times out of 10, I mean, who are we kidding? 9 times out of 10, if you tell somebody that privately and don't embarrass them,
Right.
you know what they're going to say.
Yep.
Oh my God, I'm sorry. I'm sorry. I'm so sorry. I had no idea. And
So
most of the time, they probably mean it, right? So it's like this whole cancel culture thing.
yes.
What's your intent? Is your intent to go right over the top and shame that person more than you got shamed or blamed or triggered? Or is it to help that person? Where's the genuinity of your heart?
Right.
That's a big part of what we teach in Walking the Ridge. Just because you've had triggering done to you doesn't mean you're the loser and they're the winner,
Right.
right? That's a framing thing. If you frame it that way, if I don't really go back on them, then they've won, they've beaten me. No, they haven't. That's the way you're framing it in your mind, and
Yep.
that's not good framing because it's not true. And what's more than that, it's just going to be more toxic, right, Noelle? So
Good point.
that's how I would answer that. Don't mean to be too lengthy, but there are no magical, in my opinion, there are no magical words because people don't react the same to words either, right? It's very subjective.
Yep. And it's also how the tone in which you say the words, and if I think about it with my own children, I can be yelling at them and they'll look at me. Or if I say it in a very calm and assertive way, they look at me like this very differently than, it's all in how you say what you say that's going to gravitate or get the attention, I should say, of that individual.
Spot on. It's
Yeah.
spot on. In fact, one of the lessons that's taught, and I'll just share a link. I think I shared the link to the business solution in there. You can also get to that same link and the same Walk the Ridge program. You can get to that by going to Walk the Ridge and then clicking our yellow solution button. So you don't even have to use that link, but you can. But once you're on that page, that solution page for Walking the Ridge, Noelle, there's a section on what's included, like the content. And you click that button, it'll take you to a separate page that will take you all the way through what's in this 3-hour L&D portion of the program. So
Right.
it's important to let the audience know, and if I don't clarify this, I haven't done a good job. Walking the Ridge is not a learning course. That is not what it is. It is an entire program that starts with a 3-hour learning course that anybody can take on their mobile, on their laptop, at home, at work. It knows where you left off. You have quizzes. But at the end of that, you get reporting on employee perceptions. You get the anchoring through the pin or the band. You get more than 20 PDF support sheets that complement the lessons.
Wow.
You can go back unlimited times over a year. You can bring it to your family. Frankly, let your family tap into it. If your company's okay with it, I mean, why not? And long term, what you're looking to do is you're looking to even build training around this.
Mm-hmm.
So HR and D&I leaders at companies or managers can use the PDF materials that I include here.
Oh,
They
that's
can train on
fantastic.
it themselves, so they can hire me if they want me to come in and do select training on things.
Right.
But the point is, it's a growing process, and there's a lot of flexibility. Some companies want to say, we'll just take the L&D course. We want to put it on our LMS system.
Mm-hmm.
Okay, we can do that. We have flexibility. I prefer the full management because I think it's much more empowering to have an entire process done with the reporting, frankly, than to look at it as a course.
Right.
It's
No,
not
I would
really
agree.
a course. It's a human practice that you get better at.
Yeah. And in order to understand that or see that, you need that second portion of it to really,
Yeah.
have a visualization of what that looks like.
And you can't complete the L&D program the way I have it set up. You cannot complete that unless you do the end perception report, which is about 5 to 6 minutes. And we don't ask like, hey, what'd you think of us? Give us 5 stars. It's more
Right.
like, hey, what do you think about the current state of your organization's diversity and inclusion? You
Mm-hmm.
know, and we leave it open for them to really answer. Obviously it's all confidential. We don't connect identity with answers when we
Right.
give it back to companies. But companies can get some monster insights and have gotten some monster insights about, oh my God, we thought we thought everything was good with our inclusion. We thought everything was good with employee engagement. We thought our managers were doing a good job.
Who's that
It says
way?
right here, 92% of our users are saying that on a regular basis, they're having some sort of issue with incivility with their manager.
Right.
That's a big problem. We didn't even know about it.
Right.
Well, I want to include that so companies can open their eyes to how employees are feeling, because when you have incivility, what shuts down? Contribution, trust,
Everything.
belonging, clarity and transparency on
Right.
feelings, right? All that stuff I want to open up through this on top of empowering people,
Mm-hmm.
and then giving them the accountability, which I think is a real powerful blend, frankly.
Yeah, no, absolutely. And so when you look at those that have gone through Walk the Ridge,
Mhm.
give me some successors. What are some things that people have said coming out of this that completely transpired them? Or
Well, the first is that everybody comes out better. We have close to a 95% rate of favorability from users, and we have business, we have college, and we have even city government clients that use Walking the Ridge.
that's amazing.
So that's a great number, and we're always looking to get better. Most of the people that come out through this wind up having maybe 1 to 3 of the things that we teach be their main focus points. Like, I had no idea that I was so poor in my mindfulness. I'm going to put those exercises that you
Mhm.
suggested to use. Like, one of the exercises we suggest is, you know, um, chewing each bite of food 34 times. Sounds funny, right? Chew a piece of food 34 times, and you'll really start focusing. And it's not about the food, right? It's about
Right.
focusing on one little aspect. Because the way we look at mindfulness is we want people to catch themselves in that emotional hot moment before they make a mistake. So we want them to develop different activities that can help them support that. Um, the comments that come out of this usually are that I had no idea just all the things that I wasn't doing right.
Yeah.
Or I'm usually the kind of person that doesn't ask questions if I don't agree with somebody. I just shut down. I'm
Mhm.
going to try asking questions. Or like you said, I like the idea of the band,
Mhm.
because a lot of times I feel like I want to say something, but I can't. I don't have the confidence in a
Mhm.
conversation if I disagree with somebody to say something. I feel like it's almost taboo to
Right.
get involved in a conversation. So there's a lot of things that we've gotten back, and a lot of things, frankly, from employees about management and leaders on the reporting side that
Yes.
companies were surprised about. Like, the companies thought that, you know, they're coming to us with HR issues, they're coming to us with employee gripes. It must be employee to employee.
Right.
And a lot of times there's a lot of unspoken frustration between employee and leader, that we're pulling out of this as well. And I think it's very important that, like we talked about before, that this behavioral expectation around action starts to flatten out in an organization, that the
Yes.
CEO or the manager is really as accountable as the person cutting the hedges in front of the hospital.
Yep.
Like, everybody gets this program because everybody can contribute,
Mhm.
but everybody has to have some accountability, right? You got to have some skin in the game.
Mhm.
If you don't, then you'll see some people getting away with stuff that other people aren't. And then you're going to lose, I think, a big part of the follow through here,
I agree.
and the empowerment.
And there's one thought that comes to my mind as you were talking the last couple of minutes, and that's looking at this. When you don't see what's right in front of you, or you don't hear what's right in front of you, it all becomes white noise. And as you're talking, I'm thinking this in my head, everything becomes white noise, because if you don't take that time to really break it down and understand, if you don't take that time to walk the ridge, it's like see no evil, hear no evil, speak no evil. It's all blended. And this is why we're not making any momentums or any changes going into things. So for whatever reason, the thought of white noise popped into my head. That's what I feel when you look at certain staff. They're not heard. They can't be seen. They're just, it's everything's blended, and we need to get
like Charlie Brown. Wah, 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 wah.
Yes, I love Charlie Brown.
Yeah. Exactly. And I just wanted to say one quick thing. I know on time, but another comment I got from somebody is we teach within Walking the Ridge. One of our lessons is on body language and micro expressions. And they said, I had no idea that when I check out of a conversation with somebody or they check out with me and we're standing, that they will turn their feet away and their feet will be pointing in a different direction, even though they're looking at me. And even that, they said, a couple people said that it's really interesting to know, because I want to make sure that my toes are pointed at them. It sounds like a small thing, but it really helps to condition the body into focusing and actively listening on somebody.
I love that. So, as we come to the end of the show, I mean, if people wanted more information from you, I know we put up your Walk the Ridge. Is there any other way where they can get in touch with you and contact you?
Yeah, the best way to reach me, I'm always available on LinkedIn. I love LinkedIn. So if you're not connected with me, connect with me. And if you are, then feel free to message me. I left my email. And then one of the things I want to leave today, and this is a takeaway for everybody, and this is a nice sample. This is not in any way, this is about 5% of what our solution has, but it's 5 tips for driving down incivility. And I'm putting the link right here. And so it says Learning Walk the Ridge 5 Must Live 1. That link is live and it will stay live throughout the week. That not only gives you the 5 tips that you can start using, but also gives you 3 takeaway lessons you can download and share freely. You have my okay to share these lessons that I've plucked right out of the Walking the Ridge program. It's about 5% of the program, but it's shareable, and at least it'll get you started and give you a taste. But ideally, Noelle, I think every organization, I really do, should purchase and be using Walking the Ridge. I think it just is a great gap filler. And at $10 to $12 an employee, it's really not priced expensively to make a big difference. It really isn't, when you see everything that I've really put together with this.
Yeah, no, I agree. And we'll make sure that all of these links posted in the chat get on the live show as well. And into
Thank you.
You have everything. And Steve, it's been such a pleasure. I love listening to you, and I love hearing about the success with Walk the Ridge. And I'm so happy that you joined the show today, and I look forward to hearing more about it. And please, for those of you that are watching and follow up, definitely take a look at Walk the Ridge, see what it's all about. And I can even attest and assure you that you will not go wrong with this. So thank you so much, and have a great rest of your day, everyone. Bye.
Thanks, Noelle. Thanks, everybody.
And then just stay on for a little bit, because the feed is a little bit slow going into it. And I want to make sure that we get your websites on there too.
We never did get any questions. I don't know what happened there.
Yes, I noticed that too. There was a low volume. I kept trying to look back, but I didn't want to, keep looking down and up.
Right.